Welcome back to the Takeout. As promised, joining me now, Illinois Democratic Congresswoman Nikki Buzniski. Congresswoman, great to have you here. Just for your knowledge, I've been covering shutdowns in Washington since the mid-1990s, and I know, as a threshold matter, reasonableness is always in the eye of the partisan beholder, okay? But the vice president just said it is unreasonable for Democrats not to allow the government to stay open while negotiations continue on health care and other matters. Why is that unreasonable?
Well, look, they've had 6 months to reach an agreement on a budget. They've been unable to do that. And what is really unreasonable is the manufactured health care crisis that Republicans are inflicting on communities that I represent in central and southern Illinois, a largely part of the rural part of America that have a lot of community health centers that are really facing very difficult decisions. When I hear from constituents on a regular basis about their increasing premium costs, healthcare is becoming unaffordable, and it's unreasonable for the Republicans to not be addressing this and to be barreling us down what looks like a path to a shutdown.
Well, how does the government shutting down, partial or in full, assist those constituents you just described? Because they're not going to get any help while the government is closed at any level.
Yeah, the government shutting down is the last thing that we want. But what we do want is, again, a seat at the table and for Republicans to acknowledge, again, the manufactured healthcare crisis that they have created, and looking at the budget as a way to actually address the tax credits that are going to be expiring from the ACA. Constituents in my district are going to get notices as soon as next month that their premiums are going to be increasing by at least $1,000. So these are things that are impacting working Americans in real time, and we feel very passionately that that should be a part of any budget negotiation, which is addressing this crisis that Republicans have created.
So based on your conversations in the Democratic cloakroom and whatever you've heard from the Democratic leadership, how does this week play out? It doesn't look like there's any off-ramp.
Well, look, I really hope that there were conversations today. It doesn't sound very optimistic that much was necessarily reached as far as negotiations go. I still hold out hope until midnight tomorrow that we'll be able to have everybody come to the table, and Republicans realize that in order to get a CR passed, they're going to need Democrats in the Senate in particular to come along on that vote. And in order to do that, we're asking for something very simple. They need to at least be looking at extending the ACA tax credits or addressing the manufactured healthcare crisis that they've created around Medicaid. Something has to give. Democrats are just not going to continue to stand idly by while this healthcare crisis is inflicted on the American people.
The vice president again said something the White House says with some frequency, which is one of the asks from congressional Democrats is to somehow reestablish federal subsidies or Medicaid allotments for those who are undocumented in our country. It's against federal law for that to happen. What I'm curious about, Congresswoman, is how much do you hear about that concern from your constituents?
What I hear about are Americans in my district, constituents I have in the 13th district, facing difficult choices between paying their grocery bill and affording prescription drugs. Rising costs due to this administration's trade wars and rises on tariffs, and that's leading directly to increased costs for consumers. Instability and uncertainty for our farmers, the crisis that they are creating. I will also say not only does the government funding expire tomorrow, but so does the Farm Bill. None of these things, these have been failures of Republican leadership. They've been able to get these things done. And what I hear from my constituents is that they want relief, they want costs to go down, and they want accessible and affordable health care.
And what signal are you looking for, Congresswoman, that the posture from the White House or Senate Republican leadership is changing? Because right now it appears very hardened and very dead set on forcing your side to capitulate, and rapidly.
Well, it's unfortunate because I would say that they need to recognize the reality that in order to get a continuing resolution or a budget deal across the finish line, they need Democrats in the Senate to get that done. Democrats are making a very simple ask of the White House and Republican leadership, which is to acknowledge and address the manufactured healthcare crisis that they have created. They own this shutdown. They have made it very clear that they are the ones that are in charge in Washington, D.C. And so Democrats are asking for the votes that they will need to get this done and addressing the healthcare crisis in this country.
Does that mean that it has to be addressed before the shutdown is ended, or do you just need some assurances that it will be subject to negotiation and resolution by the end of the year?
I think we need clear assurances. I mean, clear assurances that this is going to be addressed. And that's not what it sounds like came out of the White House today.
Congresswoman Nikki Buzniski from Illinois, Democrat, I appreciate the time. Thank you very much.